Good morning, beautiful people. I want to officially welcome you to the I Reclaim HS Summit 2025, hosted by the Association of Hidradenitis Suppurativa and Inflammatory Diseases, or as we like to call it, OSID. OSID is a game-changing organization that's all about advocacy, education, and visibility for people living with hidradenitis suppurativa, or HS. This summit is not just an event. It's a safe haven, a movement, a family. I'm your host with the most, Frank, aka Frank in the City. Woo, woo, woo. Get up out that bed. And we're about to dive into 2 days of community, truth, healing, and yes, necessary real talk. Now, if you haven't hugged yourself this morning, go ahead and do that right now. And if you're close to somebody, hug them too, okay? It's the morning time. We should all smell nice and pleasant. Thank you. Listen, we're in a space of love, vulnerability, and most importantly, reclaiming our narrative around HS. This year's theme is powerful, blossoming into freedom. And when we say blossom, we mean honoring every single part of our journey, the pain, the peace, the progress, and letting it all grow into something beautiful. And we're not just talking about symptoms this weekend. We're talking about the entire experience, from managing HS at work, to navigating intimacy, to styling your body with bandages and confidence, to healing after medical trauma. This summit is about the whole you. So, are you all here for the first time? Do we have any first-time summit comers? Yay! Oh, we got a lot of new people. Now, if you were here last year, raise your hand too. Oh, look at that. Oh, Jasmine, that is so beautiful. I love that so much. If you're an I Reclaim veteran, welcome back. If you're new here, welcome to your safe space. Over the next 2 days, you're going to hear from doctors, wellness experts, patients, advocates, all bringing knowledge and love to this space. So, do not forget to pull out your phone, download the app. It's going to have your schedule and all the things you need to navigate this amazing weekend. Now, before we dive into today's goodness, I have the absolute honor of bringing someone very special to the stage. This entire weekend, this space, this vision, this movement exists because of her. She took her pain, her purpose, and her power and created a movement for people living with HS to feel seen, safe, and whole. She's a storyteller, a fighter, a truth teller, and a leader. And more than that, she is family. So y'all make some noise, show some love, and help me welcome the founder and CEO of OSID, the one and only Jasmine Ivana Espy. Give it up! Y'all need to get on y'all feet. Welcome my girl. What's going on?
Amazing. Oh, this room is so beautiful. Hi, everyone. Yes, welcome to the first official day, but the second day of the summit. I'm so happy to have you all here. You all are so beautiful and so amazing. I'm so excited for you all to dive in these sessions today because they are so specifically curated just for patients, okay? So we first have advances with HS Therapies with Dr. Daveluy, which I'm really excited about because I know that as we're suffering with this condition, we need specific therapies, just things to help us. And so that's what that conversation is going to be about, and I'm very excited for that. And I want to give a special thanks to each of our sponsors who made this happen, because without them, their support and their love for this community, we wouldn't be able to do what we're doing. So thank you, UCB, thank you, Novartis, thank you, Insight, thank you every single person who has donated an in-kind gift to make our swag bags pop, from clean skin to HydraWear to every single person who has been involved. I really appreciate it. And yes, please give a hand clap. Make sure you all check out this calm room because we added some things. There's some meditation music going in there. There's just essential oils. It is giving a vibe, okay? I'm like, I need a blanket and a pillow, you know? So take your time, and I hope you all enjoy today. Thank you so much for coming. And yeah, Enjoy. I'm going to introduce Dr. Daveluy. We have been working together for a while with HS advocacy, education, and just other projects and things. I absolutely love his heart for the community and love his mind as well, because he's into a lot of things, and he is the perfect person to lead this next session that is introducing this summit. So I want to introduce Dr. Daveluy.
Thank you very much, Jasmine, and everybody. It's so awesome. I couldn't be more honored to be kicking off the conference and sharing as much info as I can with you. It's going to be a little fast because there's so much great stuff. I tried to jam it all into the talk. So great to see familiar faces, old friends, new friends. I'm just so excited to be here and to share everything that I can with you. So these are the objectives. Like I said, I put a lot in the talk, so it's going to move a little bit fast. I'm going to try my best to make everything very understandable, because I know usually research and everything is not so understandable. So we'll start off with the diagnosis and some basics about HS. As you probably know, it usually shows up in the teens or 20s, but now we are very much recognizing it can show up any age. So it can happen when you're older, it can happen when you're younger. The typical signs that we see are inflammatory nodules. Those are the red lumps and bumps. Oops. Abscesses, which sometimes people call boils. So that's a bump that has that fluid pocket in there. The ones that are so painful until someone lets that fluid out of there. And then tunnels. So we used to say fistula, sinus tract. We said, let's just simplify and say tunnels. So we don't have to get all confusing with these different terms. It's just much easier. And of course, you probably know it causes scars. And then comedones are the medical term for blackheads. And we'll talk about in another slide, HS gets these specific blackheads where it's sort of like one bump with multiple blackheads coming out of it. So like one little hill with these little blackheads in it. And HS is one of the only things where we see that happen. The typical locations are the armpits, the groin, the buttocks, the inframammary, which is the underbreast, but it can show up anywhere you have hair follicles. So the only places it can't show up are your palms, your soles, and the pink part of your lips. Everywhere else, HS can go because we actually have hair everywhere else. A lot of it's just our little peach fuzz hair. Symptoms, pain is number one. Pain is also the number one reason that patients go to seek care for their HS, which I'm sure everyone in the room knows. When it first starts off, you try to manage it yourself, but when it's too painful, you say, I gotta go in. We're paying more attention to itch because we haven't paid enough attention to itch as a symptom of HS, so we finally are. And we're also looking at odor and drainage because we know those really impact people's quality of life. HS has a huge impact on people's quality of life, really the biggest out of all the skin diseases, and some studies show it has a bigger impact than cancer. So I'm sure I do not have to tell that to anyone in the room because you're living it. And then we also, one of the things that really defines HS is that it's chronic and recurrent. So chronic means it's not a short-term thing, it's a long-term thing. Once it shows up, it stays for a very long time, maybe your whole life or at least years. Recurrent means comes back. So it flares up, calms down, flares up, calms down. And we'll come back to this idea of 2 recurrences or 2 flares in 6 months is really typical. And like I said, we'll come back to that in a minute. We don't really know how common it is. Different studies show different amounts, somewhere between 1% to 4% of the population, but it's hard because there's so many people undiagnosed that it may be higher than that, and we really don't know. In the Western world, like the Americas, it's a 3-to-1 female to male ratio. So there's 75% of the patients about are female, 25% male. What's really interesting, and we don't have time to dive into it totally, is it's not that way in every part of the world. There's parts of Asia where it's more common in men. So we're trying to figure out why is that happening? What is the difference? Is it genetics? Is it environment? We don't know yet. We also have studies that were done right here in Detroit, right across the street at Henry Ford, that showed there's a higher prevalence in African Americans compared to Caucasians. So that means when you look at all the African Americans and all the Caucasians, there's a higher percentage of people with HS in the African American community than in the Caucasian community. But because there are more white people in America, there are more white people with HS when you just look at the raw number. So it gets a little confusing. So it's kind of like you can think the risk is higher if you're black than if you're white, but it happens in all races, all ethnicities. It doesn't discriminate. And then, like I said, we're recognizing it more and more in our adolescent patients. I'm not going to dive super deep into the myths because my research assistant, Aya, is going to come up and really dive into the myths. But I just want to take a moment to apologize from the whole medical community for all of the doctors and healthcare providers who have shared these myths or made you feel shamed or blamed, because we got a lot of work to do getting healthcare providers to understand that these are myths and to stop telling people you have it because you're overweight or you smoke or poor hygiene or it's a sexually transmitted infection. So we're working on it. We're trying to increase awareness and get providers to stop causing problems and pain. And then some of our challenges with HS are that third bullet point on the right, there's an average delay of 7 to 10 years when the disease shows up before you finally have someone tell you, you have HS. During that time, patients aren't sitting at home. They're going in and seeing doctors. The doctors just aren't recognizing what HS is. So some studies show they saw an average of 5 doctors over 17 visits. So keep going to the ER and urgent care, and they say, you've got boils, you've got abscesses. Finally, they see someone who goes, oh, this is HS. 79% of people don't see a dermatologist the first time. Makes sense. You usually don't go straight to the derm. You see your primary care, your gynecologist, your pediatrician, the ER, the urgent care. So we really got to educate those doctors about what HS is and make sure they've heard of it and can recognize it. And then the last bullet point shows part of that huge impact it has. This was a study out of Germany, and patients missed an average of 34 days of work a year. So that's over a full month worth of work. 10% said they were fired because of their HS, and almost a quarter said they missed promotions because with missing time from work, your boss says, oh, you're not a great candidate for this. This is going back to that easy thing. So this is what we're really pushing for the doctors to know is if you ask these 2 questions, have you had outbreaks of boils during the last 6 months? Where and how many have you had? And if they've had 2 outbreaks of boils in those typical locations, there is a 96% chance you have HS. It is not a hard diagnosis to make. It's the only diagnosis where patients come in and go, I Googled it and I think I have HS. And I go, you're right. I'm gonna look and confirm, but you're right. Every other skin disease, they get it wrong. Google's gonna tell you it's eczema if you have psoriasis and vice versa. But HS, you can diagnose yourself. So I don't know why doctors aren't doing a better job, but I think it's just awareness. They've never heard of it. They don't see it. They don't think they're seeing it, but it's seeing them. Here's some of the things we talk to docs is you can have classic HS, typical lesions, typical locations, nodules, abscesses, tunnels in the armpits, the underbreast, the groin, the genitals, the buttocks. So that's kind of the classic. But you can also have HS where there's not the classic lesions, but they're in the classic spots. So you have more like folliculitis, which is like body acne and those comedones in those typical spots. Or you can have the typical lesions, the nodules, the abscesses, in places that we don't think of as the most classic, like the waistline, the neck, around the ears, pretty much anywhere. So we're really telling them that think of your classic HS, but don't think it's not HS if you're seeing something like this folliculitis on the buttocks. The differential diagnosis in medicine is when you look at something and you say, what could it be? Make a list of things it could be. These are probably some things you've heard as you were misdiagnosed over the years. So bacterial abscesses are infections. And the reason HS looks like a bacterial abscess is because you can almost think of HS as your body thinks it's fighting an infection, but it's actually fighting you and your hair follicles. And that's why HS looks so much like an infection. It's the exact same motions of the immune system as if you had bacteria. The immune system shows up, walls off the bacteria, destroys it, which creates a bunch of pus inside. But it's just doing it to your hair follicles and your skin instead of there being an infection there. Same thing, inflamed cysts look really similar. It's when you have a cyst and it breaks and then the body kind of treats it like an infection. We talked about the folliculitis as sort of that acne. I'm sure many of you heard folliculitis before anyone figured out it was HS. Pilonidal sinus or cyst is basically HS at the top of your booty crack. The only reason we separate it is because some people only get the pilonidal sinus or cyst, but the two often come together and you get both of them. Cellulitis is an infection. Cellulitis is also kind of the garbage term that docs use if they don't know what you have and it's a skin thing. They go, it could be cellulitis, just because they're like, that's the one thing they know. And then Crohn's disease is inflammatory bowel disease, and it can mimic HS sometimes, but it usually has these ulcers, and it's not the most pleasant word, but we say they look knife cut. So it kind of looks like someone slashed them with a knife, and that's just the way the ulcers kind of open. That's a tricky one to tell apart, probably need a dermatologist. We tell them, again, it's chronic with acute flares. So you start off with these abscesses that come and go, but then it develops into this chronic disease with scarring and tunnels. We'd like to prevent this from happening. So that's the future goal, is that no one progresses because we get you on effective treatments, get it under control. This slide is a little busy. Oh, did it? I must have messed up my animation. But I can still talk through it. So this slide showed in that top left corner, and this, you'll see at the very top, this was done last month, this was published. So very recent literature. The bad news here is docs still don't recognize HS. So that top slide shows different specialties and how well they recognize it. And you can kind of see that 96% peeking out. That was dermatologists were shown this picture of an armpit, which is very obvious HS. Couldn't be anything else. 96.5% got it right. I want to know who those other 3.5% are so we can take their license away. And then if my big thing wasn't in the way, you could see the other specialties and how they did. It was pretty sad. Gynecologists, less than 1 in 4, recognized this as HS. Urologists, it was about 40%. Surgeons did the best. They were about 63%, but still not great for very, very obvious HS. Then those other pie charts all around they show different stages in different locations, and you want the circle to be full of the blue, the regular blue, not the teal. That means they diagnosed it HS. The dermatologists are in the one corner, and you can see the other specialties, the piece that is blue is very small, meaning they did not recognize HS. So we have a lot of work to do to help doctors recognize what HS is, which is really sad because, like I said, it's a very easy diagnosis. If they ask those 2 questions, do you get boils that come and go in more than twice in the last 6 months? You have HS. I also tell people, if you want to keep it easier, if a patient has more than 1 boil in their lifetime, send them to the dermatologist. No one should have 2 boils. Pathophysiology is what we understand about sort of the cause or what's going on inside with HS, like the deep science. This is a picture we love to show. It's the skin, and then those things sticking about are the hair follicles. So early in HS, the inflammation is all around the hair follicles. That's why laser hair removal can be helpful early on, because you get rid of those hair follicles and it kind of calms down. Now, we don't know why the inflammation is attacking the hair follicles, but we've figured out that's one of the early things. Then as it kind of moves on and you get more inflammation, you get the destruction, and you see it forming those tunnels and kind of disrupting everything. There's a lot more to the pathophysiology. So we've got the hair follicles get blocked up, there's the abnormal inflammation, but then there's all these things that can play a role, like friction, maybe smoking, the bacteria. The normal bacteria are different in HS patients than in people who don't have HS, and their normal skin versus their HS skin. Hormones play a role, and it's different for everybody, which is one of the big things with treatment too. You cannot predict a response. Everybody's a little bit different, and you have to kind of try a medication and see how it does. This is a crazy science slide, but I'll break it down a little. This shows that we now know once you start getting those tunnels, which are those kind of big yellow areas, all those little circles around it are inflammatory cells. And it's crazy because when they take the tunnels out and look under the microscope, it almost looks like a lymph node because it's got so many inflammatory cells in it. And the reason I'm showing this is because we now know that early on, the hair follicles are where all the inflammation is, but once you start getting tunnels, those tunnels are little inflammation machines, which is why a lot of times people hit a wall with their medical therapy, because if you still have tunnels, the medications don't tend to work as good, but then if you get those tunnels treated with surgery, a lot of times all of a sudden you do way better and things get under control. So that's one of the things we're trying to teach docs too, is there's sort of different phases to the treatment. We know it's more than skin deep. This is something we call comorbidities. So comorbidities are when you have this disease, you are more likely to get another disease compared to people who don't have your disease. So if you have HS, you're at higher risk of having depression, anxiety, suicidal thoughts, tobacco use, arthritis, inflammatory bowel, polycystic ovary syndrome, cardiovascular or heart disease. So a bunch of us nerds got together and we looked at all the science behind this and came up with recommendations. So for every HS patient, one of your doctors is supposed to be asking or looking at all of these things. Some of them are kind of routine things like height, weight, blood pressure, cholesterol. Some are less routine. We should be asking every patient about their mental health and their sexual health. I know it's not happening as much as it should, so we need to kind of shift the mindset for healthcare providers to make sure they know, ask these questions. These are important for patients. And then that little box to the side, it's interesting. If you have Down syndrome, your risk of HS is higher. So we're trying to reach out to the Down syndrome community and say, you need to be aware of this. Ask your children or yourself if you're getting these boils and talk to a dermatologist. This was an interesting study. There's a few studies that are kind of looking at the why, because everybody, when you first get it, you're like, why did I get this? Why is this happening to me? Did I do something? Why? And these studies don't prove a cause, but they just show us some trends and things. So this looked at when you were diagnosed with HS, what neighborhood did you live in, and what is the SES, the socioeconomic status? Basically, how much money do people in your neighborhood make? Are you from the rich neighborhood, or are you from the hood? And so they looked at what is the risk of HS, and what do you know? The risk of HS is higher in communities that have lower income. Now, we don't know what the reasons are for it, which is sort of the next step in the research, but they did this where they do all these statistical things to look at, are there other factors? Like, is it just that there are more smokers in the lower income communities? But you can see smoking didn't have as big of an impact. So it's probably more things like structural racism, access to healthy foods, all kinds of things that really impact different communities differently and give people privilege when you come from higher income communities. Again, the risk is higher, but it's not zero. Rich people get HS too. You can't avoid it, but the risk is higher if you come from a neighborhood. This also was really interesting that came out last year. They look at processed foods, which is like fast food, Twinkies. The opposite of a processed food is a fresh vegetable. Processed foods have all the preservatives and things in them. And they looked at plastics, and they found that compared to people without HS, people with HS drank more canned beverages per week, probably pop, or if you're not from Michigan, soda. They use more single-use plastic water bottles, and they noted more sweating. And the reason the sweating matters is because so if you haven't heard already, plastics are bad for us, and we've done a terrible job, and we're all eating about a credit card's worth of plastic every year. Plastic leaches out of water bottles of any plastic container and gets in your food. If you microwave plastics that aren't microwave safe, it puts even more plastic into your food. So check those things. Maybe just try to not put plastic in the microwave. These chemicals in plastics last forever, which is why plastic is so great, is because it lasts forever. But it also lasts forever when it gets in you. And it likes to concentrate in your sweat. So this was a really interesting study where they noted people with HS noted more sweating in their groin, in their skin folds, and these plastic chemicals were more likely to be seen in HS patients. So that might be one of the things, I'll be honest with you, I think plastics is part of the reason a lot of our diseases are getting worse, because we've really gone in the wrong direction with the way we do food in every way in processed foods. So let's talk treatment. I tell all my patients, HS is kind of like a house fire. We have medical therapies and surgical therapies. The medical therapies are the firefighters. They fight the inflammation, they put the fire out. Then we assess the damage once the fire's out, and we call in the carpenter, which is the surgery, to fix the damage. So it's kind of a two-phase thing, and sometimes they happen at the same time, sometimes it's one then the other. Sometimes I even have patients come in who have had HS for a long time, and the inflammation has turned off, and all they have left is the damage, the tunnels, the scars, and I say, you actually don't need medicine, you just need surgery, but that's rarer. I also tell them there's no one-size-fits-all. Like we said earlier, I can't really predict what's going to work for you. We're going to start this medication, and when you come back, we'll see how well it's working for you, and we'll decide what we're going to do. We have to kind of try things out. And then combinations are sort of the rule with HS. So if we start a medication and it gets you 50% better, we're not going to give up on that. We're going to add to your regimen until we get you to 100% better. So if we add another drug and you get 20% better, and then we add another, you get 10, another, you get 20, all of a sudden you're under control. And that's one of the things we're really trying to teach, especially dermatologists, because we don't have a lot of other diseases where we have to stack drugs like that. But HS is unique that way, and they're used to treating psoriasis, and some of these drugs for HS, when you give it to someone with psoriasis, the psoriasis just disappears. They don't even think about it anymore. But it's not that way with HS. And we also often have to combine medicines and surgery. So it's another thing we're teaching derms is when the patient comes back in, how do you know which one they need, which we'll talk about. I always set expectations. I say, we're on a journey together. I'm here with you. I won't give up on you. We're going to stick with it so we get you under control. Don't give up on a medication if you have a flare after we start it. That doesn't mean it's not working. I need you to pay attention to those flares. Are they less intense? Is there more time in between them? Are they shorter? So it goes from being this up and down disease to kind of mellowing and flattening out. And that really helps patients to understand when they come back to me what I need to know in terms of, is this working? Is it partially working? Is it helping? But I always tell people that because most other things, if you start a medication and then you flare up, you're like, all right, next, what do we do? So I tell them, no, you may have a flare that takes a little time to kick in. This is an awesome free app on every platform now. It's free. It's called Papaya. You can track your symptoms. You can track your triggers. When you come to the doctor, you can show them a little one-page report of how you've been doing since the last visit. It also has a bunch of resources, including the HS patient guide, which I'll talk about at the end. So it is a really great resource that I try to encourage all my patients to download. And then when it comes to the treatments, we break them into three things: lifestyle modification, medical therapies, surgical therapies. I already kind of mentioned the medical therapies, reduce that inflammation, which is the redness, the swelling, drainage, pain, and then the surgical therapies treat those tunnels and sometimes the scars, kind of the leftovers. Lifestyle modification are things you do day to day that either make the HS better or worse. Again, different for everybody. These are the ones from the 2018 North American Treatment Guidelines. We're in the process of updating the guidelines. Tomorrow I actually have a 6-hour meeting where we're talking about them, so that will be fun. So they say, if someone's a smoker, counsel them that smoking cessation may help or quitting. Screen for obesity and talk about weight loss if it's present. Maybe oral zinc can help. There's some studies that show it can be helpful. And then they said there's not enough evidence to recommend, so there's not enough studies and hardcore data to recommend these other things, but they may help some people. So avoiding dairy or brewer's yeast, taking vitamin D, avoiding friction, maybe deodorant, maybe shaving and hair removal. So these are those things that we don't have enough evidence to say do it for sure, but it's a good thing to discuss. And I always tell patients, this is where you play detective and you figure out the things in your life that are making it better or worse. Patient organizations are the best resource. ACID, HS Connect, Hope for HS, talk to other patients, figure out what's worked for them, try it for you. Know that it may help or it may not help, but figure things out. With smoking, HS is not a disease of smokers and smoking is not the cause, but we do know that nicotine can be associated with flare-ups. And this complicated little picture actually shows where the nicotine affects your skin cells and your immune cells and gets more inflammation, which we all know smoking's not great for you, right? So I usually bring it up with my patients and I say, look, I know you're probably trying to quit smoking. I totally know it's not easy, but I'm sharing some info in case it helps you on that journey, is that your HS may improve if you quit smoking. And then this last study showed that people who either quit smoking or never smoked were 3 times more likely to have a response to treatment with a medical therapy. So things work better because it doesn't have to fight the inflammation of the smoking. So I say it's just one more reason, and if there are resources I can share with you, let me know, but let me know when you're ready. Same thing with weight management. So there are people with HS are more likely to be overweight or obese, but again, it is not the cause. It is not every patient with HS is overweight or obese, but they are associated. We also don't know what's the chicken and what's the egg. Were you obese at the beginning and then got HS, or did the HS make you not have, be able to do exercise and activities, so then you gained weight? We don't know. There are some studies that show if you lose 15% or more of your body weight, it can help, but again, different for everybody. Some people lose weight and it makes no difference. Some people are super skinny and have horribly severe HS, so it's not everybody. This is a really cool article. If you search Nutrition Education Toolbox for HS, it'll pop up. It's a free article that you can download. The article part of it's all in medical terms, but it has these PDF handouts that really go through what we know about diet and HS and make it simple with these little choose brown rice, not white rice, choose whole grain bread instead of white bread. So it's a nice resource that you can share. You can kind of look up, make some dietary changes. At least it helps kind of guide people to know what may be dietary triggers. Dietary triggers are huge for some people and nothing for other people. So, maybe I'll just stop saying that because that's true for all the treatments. Works for some, doesn't work for everybody. Shout out to one of our sponsors, HydraWare. I love HydraWare, no conflict of interest with them, but Suzanne is an HS patient from Ireland who got sick of there being no bandages for HS and trying to make things work in areas that they don't work, which I'm sure you've all lived. So she created this clothing that holds bandages. You can see it basically has these holes in the areas where you usually get your HS, and it has these little pads that slip in, and then a Velcro goes between two of the holes to hold the pad in place. If you need to change it, you run to the bathroom, slide a pad out, slide a new one in. Very convenient. You can wear it under your clothes. I talked to Suzanne about this, and she was like, oh yes, I've heard it from patients too. Also kind of useful for intimacy, because now, as you can see from the woman's crop top, if you're having some drainage in your axilla, but you and your partner want to get frisky, you can just kind of cover it up and still have access to other areas that are important during sex. Treatment is stage-based, so you guys have probably heard of this Hurley staging. The Hurley staging was invented to see, are you a candidate for surgery? So stage 1 is you get spots that come and go, but when they're in between flare-ups, your skin pretty much looks normal. No scars yet, no tunnels yet. This is usually that very early stage when people are trying to figure out, do you have HS or not? Stage 2, you start to get the scars and tunnels, but in between them is normal skin. So you can see there's scars and tunnels, but there's these little strips of normal skin splitting them up. Stage 3 is when it takes over the whole area. That whole armpit is all HS scars and tunnels. It's kind of obliterated all the normal skin. So stage 3, definitely a surgical candidate. Stage 1, probably not. Stage 2, case by case. So that's what it was invented for. We use it a lot in the clinic because it's so quick and easy to just do. Whatever you have one armpit that's stage 3, you are stage 3, because some people never go from 1 to 2, some never go from 2 to 3. So as soon as your disease gets to stage 3, I know that what it's capable of, and that adjusts the way I'm going to treat things. Another question we get sometimes is, all right, so if I have it removed surgically, am I not stage 3 anymore? And for the same reason, I go, no, you are. Your disease got to stage 3. I know what it can do, and it's under there, and it would try to do it again if we don't get it under control. This is a really huge topic we're talking about with doctors right now, the window of opportunity. And the idea here is if you treat HS earlier, it's easier to treat. So that's that idea, like I said earlier, when the inflammation is just around little hair follicles, it's easier to control, but once you start getting the tunnels, everything gets harder. So that top study showed if someone had HS for 10 or more years, they were half as likely to respond to Humira. The other one is if you had tried 5 different HS treatments before starting Cosentyx, you were half as likely to respond. So we're really pushing the docs that we need to treat early. We are waiting too long, and we are waiting for it to be so severe, but we need to get it under control early. Sometimes we talk to them about acne, and we say, in acne, if I see a scar, I immediately go for Accutane and try to turn it off before you get more scars. We need to think that way with HS. If I'm seeing scars, I want to turn it off before you even get your first tunnel. So it's a big push to treat earlier and get it under control sooner. Again, medicines stabilize disease. So one of the big questions I ask my patients is, are you getting new spots, or is it just the same spots bothering you? If you're getting new spots, I need to add to your medical therapy till we get that to stop happening. If you go, no, I'm not really getting new spots, but this tunnel just always drives me crazy, or this one spot comes and goes and is painful, then I say, okay, those spots need surgery. You're basically optimized on your medical therapy. It's doing what it needs to do. The activity's off. We just got to clean up that damage that it caused. This is another picture from the North American Treatment Guidelines. It's kind of like a list of all the things. Some of them we use in later disease, some in early disease, some throughout disease. Like I said, this is from 2018, so we are updating it now because there's been a lot of developments and a lot of new things. You can break down the treatments into topicals, things that go on the skin, antibiotics, hormone treatments, and immune system treatments. And we kind of combine. I usually try to pick things from different sections. We still do use a lot of antibiotics, but it's not an infection, which we'll talk about. And luckily, with newer medicines, we're getting away from the antibiotics because they're not the best treatment for it. So we'll kind of talk about each one of these. So antibiotics, again, HS is not an infection, but bacteria may play a role. Even though it's not an infection, not contagious, you can't spread it, your bacteria in your HS lesions are different than what we see in people who don't have HS, and your immune system might really hate the bacteria. So it might be trying to kill them and treating them like an infection, not realizing they're not an infection. They're what we call flora, like normal bacteria. If you didn't know already, you're covered in bacteria, your gut is full of bacteria, and we actually work well together with each other when everything's balanced. When it's out of balance, we have issues, we have problems. So that's why people get like really bad infections if they take antibiotics and their gut bacteria get thrown off. You get really bad diarrhea. A lot of the antibiotics have an anti-inflammatory effect. So we even use doses where it doesn't affect bacteria at all, but it's anti-inflammatory, and that's how it works. Not all antibiotics work for HS. So a lot of times patients come in and go, oh, I've had lots of antibiotics. And I go, well, which one was it? How long was it? In HS, we usually use them because we want that anti-inflammatory effect. We use them for weeks to months, not 7 to 10 days like an infection. The tricky thing is the average HS flare lasts 7 to 14 days. So you have a flare-up, you go to your doctor, they give you an antibiotic that's not going to work, but they give you 14 days, and that's the average time a flare is going to calm down anyway. They think they helped you. You kind of think they helped you, but it was going to do that even if you didn't take it. These are the antibiotics that do have studies that show they work. Doxycycline, minocycline, or tetracycline, clindamycin with or without this other one called rifampin, dapsone, that triple one, or ertapenem, which is only available IV or as an injection in the muscle, but it works really good when you're on it, and then you flare back up when you're off. Hormonal treatments, that can include birth control, but not all birth control. So the ones that have estrogen tend to be better. The ones that are progestin or progesterone only, like the Depo shot or the hormonal IUD, can make HS worse. So I tell all the docs, ask about birth control, because a lot of times patients don't think to tell me they're on the Depo shot because it's not a pill they take every day. And I've had a couple patients, I've had quite a few who have flared up after they started the Depo or got a Depo shot. Others where it started, and when we got them off the Depo shot, it actually resolved and went away. They only had it from that birth control. Like I said, the estrogen ones, so the easy way to remember it is the ones that are approved by the FDA for acne help HS. So if you just can't remember anything else, like give me one that's approved for acne. Spironolactone is a pill that doesn't change your hormones, but stops them from affecting your skin, and it can be really helpful in female patients. We tend to not use it in males because it blocks those hormones. It can have sort of some feminizing effects and make them more feminine. Finasteride is a pill that we use for hair loss and for prostate issues, and it's been studied in men, women, and teenage girls and shown to be helpful in all. Not huge studies, but it's an option we can reach for. And then there's this diabetes pill called metformin. That's also been shown to be helpful in some people, and it kind of has some hormonal effect. I'll briefly mention the GLP-1s, that's your Ozempic, Mounjaro. We're starting to see some evidence that they might be helpful for HS. So 2 small studies, one had 14 people, one had 30 people, did show some improvement in the HS. And the first one, they looked at did they lose weight or not, and even in people who didn't have weight loss, the HS could improve. And it's because these GLP-1s not only make you feel more full and tell your brain you feel full, slow down your bowels, but they affect your immune system and kind of calm it down a little bit. So more to come on that, but you may hear about these medications and it may be an option, so stay tuned. Immune system modulators, or for short, immunomodulators. These calm down your immune system. I don't use the word immunosuppressant because suppressing it is not, that's too extreme. That's not what we're doing. I always tell patients, if a normal immune system is my right hand, with HS, yours is up here going crazy, and you can tell. You're red, you're swollen, you're inflamed. These things bring it back down to normal. And so that is sometimes helpful because when people think like, well, you're going to weaken my immune system, I say, well, because your immune system is going nuts. We need to just calm it down, put a little straitjacket on it for a minute. So steroids can help. We don't love steroids because they have lots of side effects, but in a pinch, when you're really flared up and you're out of options, we give people a little course of steroids for a few weeks. If your vitamin D is low, taking vitamin D can help. So if you want, just take 800 to 1,000 units of vitamin D a day anyway. If you live in Michigan, you can't get it from the sun because it's not sunny enough here year-round, so just take it from your diet. Again, zinc can be helpful, so there's been a few studies on that. So that's something you can talk to your doc about, is the zinc. In the guidelines from Europe, I think, they actually recommend checking a zinc level and giving it if it's low. Same thing, they had some studies where when people would get bowel surgery, like bypass surgery, gastric surgery, some people improved, some people flared up. The people who flared up were deficient in zinc because they didn't keep up. You got to take a lot of vitamins if you have bypass. And so they found, like, if you have bypass, lose weight, but your HS flares, check your zinc. It might be low. And then our biologics. So these are the 3 biologics that are approved for HS. These are the hard-to-say generic names. Adalimumab is Humira, secukinumab is Cosentyx, and bimekizumab is Bimzelx. So we'll talk about each one of those because these are the approved drugs. But first, what is a biologic? Why do we call it a biologic and not just a medication? So it's not a chemical that they make by mixing things in the lab. They actually are antibodies that are made by living cells. So it's this really cool process where they culture cells. Back in the day, like if they make, apologize to all the animal fans out there, but if you need anti-venom for a snake bite, they actually have snakes bite horses. And then the horses make antibodies against the venom and they don't die, and then they give you horse antibodies to block the snake bite venom. So this is that same idea, but instead of using horses, they grow these tissue cultures that then make antibodies, and they say, make an antibody that blocks this overactive thing from HS. So some of the differences between biologics and regular drugs is they're much bigger because they're big like our antibodies. They're not tiny, tiny molecules. They're made of protein, which is why you can't take it as a pill. You would just digest it and it wouldn't do anything. It would be like a little protein supplement. That's why they have to be injected or given to you through an IV. They almost never, in fact, I don't know of any interactions with other drugs because they're not drugs, they're antibodies. And your body handles them like antibodies, so they're not stressful to your liver or your kidney. They're the same proteins that are already circulating in your blood and keeping you safe from everything. Things to think about with biologics are, like everything, the response can be a little different, and you might respond to one, not to another. So just because one doesn't work great, you might switch to another, and for some reason, that was just what your HS needed. It can be rapid improvement, but we know for all the biologics in HS, they don't really peak until 6 months. So you kind of keep having this gradual improvement. So I always just tell that to patients, like, all right, as long as we're continuing to see improvement, that's great. Usually around the 6-month mark is when they maximize what they're doing. The sad news is they looked at a study and they found that 66% of HS patients were moderate to severe and should be offered a biologic. And when they saw who was prescribed a biologic, it was 2%. So we have a lot of work to do at getting doctors to offer these medications to patients. Right now, they're our most effective treatments out there. It's helping us to not use so many antibiotics, which we know can have other effects on the body. But we've just got to get people out there treating and utilizing them. This is the clinical trial for Humira. And so at the very bottom, you'll see this HISCR. We call it high score. That is the test to see if a drug will get approved or not. So the high score means we count the number of abscesses, nodules, and tunnels, and the number of abscesses and nodules has to go down by 50%. So if you have 10 at the start of the trial, you have to have 5 when the medicine's working for us, 5 or fewer, for us to say that it's working, good for you, and we compare it to the placebo, which is basically fake medicine. It's a thing that they do in all these trials to see, does the medicine work or not? You have to compare it to something, and you don't know which one you're getting. So you can see for Humira, about 50% of people got that 50% or more response. Again, kind of speaks to this idea that for a drug to be approved, you have to get at least 50% better. So, like I said, we're going to stack and build things on the regimen. We're often not going to rely on one medication to do all the work. If it does, great. If you really clear up, awesome, but might not be the case. These are the studies for Cosentyx, who is made by Novartis, one of our sponsors, so thank you. Similar results, kind of get that high score 50, around 50% of people hitting it. I will point out this 50% number is at 16 weeks or 4 months. And like I said, it keeps getting better. The reason they measure it at 12 or 16 weeks is because the other group is on the fake medicine, and it's not okay to keep someone on fake medicine for 6 months. So at the 3 or 4 month mark, they get to switch to the medication in the trial and actually get something, because it's just mean to make people keep taking fake medicine. And then Cosentyx blocks IL-17. Humira blocks TNF-alpha, tumor necrosis factor. They're both like kind of communication signals that your immune system releases, and they lead to more inflammation. So blocking them shuts that signal down. Cosentyx blocks IL-17A. There's also an IL-17F, and both of them are high in areas where you have HS, where it's really inflamed. So the newest medication, Bimzelx or bimekizumab, blocks both of them. So these are the numbers from the bimekizumab trial. Here you can really see where this shows the 6 month mark, or actually the almost 1 year mark. So you can see that steady incline, where that dotted line is week 16, where they said, all right, is it working or not? But you can see it keeps working. And then that bottom line is the people who had the fake drug. And like I said, at week 16, the dotted line, they switched to the real drug, and you can see all of a sudden it starts working, because they haven't been on real drug yet, but they start responding. Quick note, because we know pain is such a big deal in HS, Lauren Orenstein, who is down at Emory, is the queen of pain in HS. She knows the most, she's done the most research, she's amazing. She talks about acute pain, when it's flared up, and then the chronic pain, the daily pain of HS. And she's figured out that there's this nociceptive pain, which is kind of aching and gnawing when you're getting tissue damage. And then there's neuropathic pain, where the nerves are not functioning right because they've been so damaged. And so that's that kind of burning sensation you can sometimes get. And I just want to point out this duloxetine is an antidepressant. But we use antidepressants to treat pain, because antidepressants work on nerves. Nerves carry pain signals. So when someone offers an antidepressant for your pain, it doesn't mean they think you're depressed. They're not dismissing your pain. It's because it can help the nerves to be a little calmer and not send so many of those pain signals. So don't be offended if your doctor reaches for one of these, because they're safer than opiates, they're not addictive, and they have been shown to be beneficial. Want to highlight? There's never a good time to have HS, but this is the best time it's ever been, and it's only getting better. So back in the day, not a lot of people cared about HS. When I first started out getting into HS a lot, there'd be like an article every month or two. Now I get alerts of all the articles, and there's like 15 a week being published. It is amazing. So many people are interested. So many smart and capable people are doing great things. So it is just going to keep getting better and better. These are clinical trials going on in the US. Right now, there are 53 different studies that are recruiting. You could go join them right now, and another 18 that are getting ready. So that's 71 trials in the work right now, which is amazing. They are in all different phases. They cover things that are injectable, oral, topical. They cover surgical procedures, wound care. We even have one going to see if acupuncture can help with the pain of HS. There's more than 30 different drugs being studied and more than 20 different mechanisms of action, like the way the drug works. So very exciting. There's going to be a lot more options soon, and we're going to really refine how we sort of use these drugs together, combine things. They look at different targets, so there are actually some that are looking at, can they treat the tunnels with the medication, which for the longest time meds work for the inflammation, surgery works for the tunnels. And we'll hear a lot about surgery with one of our upcoming speakers. And here are some of these new targets. Like I talked about TNF, IL-17. We're looking at more IL-17. We're looking at JAK. So JAK is this other inflammatory, it's Janus kinase. It's this another pro-inflammation pathway in your body. And they're really hot right now because they really work for a lot of different diseases. So Insight, another one of our sponsors, is studying povorcitinib and ruxolitinib cream for early disease. So those should be coming out. And I forgot to shout out UCB because they make Bimzelx, and they're another sponsor too. I love our sponsors. They make things happen. They do so much for us. But like all these different drugs are being studied. I don't even know what some of these things are until they're like, we're studying this pathway in HS. And then I have to go read all these super nerdy articles about how the immune system works and what these things do. If you want to nerd out, this is our annual meeting for the HS Uber Nerds, where we talk about all these studies and stuff. It's very scientific, but we do have patients there, and we try to explain things and break things down a little bit. It's in Nashville around Halloween this year, so we'd love to see you there. It's really great. And then here, I'm going to wrap up with some resources that you can share with your followers, with your friends, with your family, with your enemies, with anyone you want. These are great things. Clinicaltrials.gov. This is where you find all those studies that are recruiting. So you can put in the condition, HS, and then I can't show it in one screenshot, but lower down you put in your zip code, and it tells you all the studies that are happening near you and around you, so you can see, do any of these fit for me? They have a little bit of info for each one, and they have a contact person you can reach out if you want to learn more. So this is a great way to get involved with research. We're doing all these studies, and we need people to help us to figure out what's the best for HS. So it's a really great way to give back to the community. And I'll tell you, we do a lot of clinical trials with a lot of diseases. The other diseases, sometimes it's hard to convince people to help us out. HS patients are the most eager to help with research because everybody's like, anything. I'll do anything to help the community, to help advance the knowledge. And I absolutely love that. But it also speaks to the fact that we need it, right? Like, we need more information. We need more knowledge. This is the HS Foundation website. Conflict is I am on the board, but I love the HS Foundation. We have on the website resources for doctors and for patients. So you can send your doctor there to learn more. You can go there to learn more. We have these research summaries where we take research studies and break them down into language that you can understand. So you can see that first one is one of the GLP-1 articles. We've got a very popular one about pregnancy in HS. These are prior auth template letters. So if your doc is trying to get a medication approved for you, they can go to the website, download these letters, and send it to the insurance company. It's got all the science that supports it, so it makes it a lot easier for them. This is HS Patient Guide. So we wrote a text, all of us nerds got together and wrote a textbook about HS for doctors. Then we said, let's translate it to patient language. So it's totally free. hspatientguide.com has everything you want to know about HS. We need to kind of update it a little because things are happening so fast, but most of the info in there is still really great and very useful. And these are my two dogs, Bluto and Olive. And thank you all for being here. Hopefully you learned some stuff. I know it was a lot, but it just speaks to the fact that there's so much exciting stuff happening. Thank you.